Good morning, guys. Sorry it's a little late me getting this out there to you. Anyway, so chapter 5 over disease and transmission. So, let me start off on page 54 down at the bottom, pathogens. So, pathogen is a microorganism that is capable of causing disease. These microorganisms are so small that they can only be seen under a microscope. So they're pretty tiny. Um, bacteria. Bacteria are a large group of one-celled microorganisms that vary in size, shape, and arrangement of cells. So most bacteria are capable of living independently under favorable environment conditions. They grow best at 98.6 degrees in a moist, dark environment. So that's why most dental offices are so cold. So, and most dental offices will offer a blanket to a patient if they're cold. When viewed under a microscope, bacteria have three shapes: a spiral, a rod shape, and a spiral shape. At the top, you see the different shapes of the bacteria. One, the spiral shape, uh, is seen under a microscope for strep throat, pneumonia, tonsillitis, boils, skin infection, and pneumonia. The rod shape is for tuberculosis. Now, TB is airborne. Tuberculosis is airborne. It's not bloodborne. So if I had TB and I coughed, if we were at school in the classroom and I had it and I coughed, I just infected everyone. So it's highly, highly contagious. TB is. The spiral shape, syphilis, which is a sexual transmitted disease, and Lyme disease. And Lyme disease, people get from a tick. Now to spores. Under unfavorable conditions, some bacteria change into a highly resistant form called spores. Tetanus is an example of a disease caused by spore-forming bacillus. So I do recommend that you get a tetanus shot. It wouldn't hurt. Things happen in the dental office. One time I got poked by a rusty burr. Um, and uh, but I had a tetanus shot, and a tetanus shot will last for 10 years. Spores represent the most resistant form of life known. So in the dental office, when we have to sterilize our instruments in the autoclave, once a week we will do a spore test, and it gets sent off to a lab. But we will talk about that in chapters 7 and 8. Viruses, dealing with a big one right now. This is why we're all at home. Viruses are significantly smaller than bacteria. Despite their tiny size, many viruses can cause fatal diseases. So not only do we know about HIV, HIV is a virus, but also the lovely one that we have going on right now. Latency. Some viruses establish a latent, known as a dormant, state in host cells. A latent virus can be reactivated in the future and can produce more infective viral particles, followed by signs and symptoms of the disease. So someone might have HIV, but it won't show up until maybe maybe they contracted it 5 years ago, but they don't know it until maybe they got sick with the flu and it turned into pneumonia, and they ran tests and found out they had HIV, but they could have had it for 5 years before that and didn't know it. Viruses cause many clinical significant diseases in humans. Unfortunately, most viral diseases can only be treated symptomatically. So you can't take an antibiotic and make a virus go away. We can only treat the symptoms. Fungi. So fungi are plants such as mushrooms, yeast, and molds that lack chlorophyll. Chlorophyll is the substance that makes plants green. So athlete's foot, ringworm, and candidiasis are examples of disease caused by fungi. So one of the major ones that we deal with in the dental office is called candidiasis, oral candidiasis. And oral candidiasis looks like a baby can have thrush. A baby, I don't know if you've ever seen thrush. It looks like cottage cheese on the tongue or in the mouth. So oral candidiasis can be treated with antibiotics, a mouth rinse, an antibiotic mouth rinse, or a lozenge. So you'll see in older patients, especially older women that wear dentures, they don't want Papa to see them without their teeth. So they'll wear their dentures 24/7. And so constantly underneath that denture, their mouth is moist. And so they can create oral candidiasis from that. Little weird story. So I was assisting the dentist with a cleaning one day, and the dentist said to the patient, by the way, does your wife have a yeast infection? And he was like, yeah. Yeah, how do you know? And the dentist let him know that he had it in his mouth now. So, yeah, pretty gross. So, kind of watch out for things like that if you have a yeast infection. So it does. I do go on Google yeast oral candidiasis, and you can see images of what it looks like in the mouth if you're wondering. The lesions may resemble thin cottage cheese. It's red and raw and sometimes bleeding. It's very painful. Candidiasis is treated, like I said, with antifungal prescriptions. Also, I mentioned infants get it, but also high-risk patients like someone with HIV. But if someone comes in and they have oral candidiasis, don't think, oh, they have HIV, because that's not always the case. So chains of infection. Chains of infection are going to be how the infection gets into our body. So the infectious agent is a pathogen or a bacteria or a virus. And this means the degree and the strength of the organism has the ability to cause disease. The reservoir is the place where the organisms normally live and reproduce. So the human body is our reservoir. And then port of exit, how it exits our body. How are some of the ways that it exits our body? So we have port of exit and port of entry. So anything with a hole, our nose, our mouth, our eyes, our ears, our vagina, our butt, anything with a hole, a cut, a puncture, anything with a hole is port of entry and port of exit. Numbers refer to the concentration of pathogens that are present. The more pathogens that are present, their chances of overwhelming the host and producing the disease. An infectious disease is one that is communicable and contagious. Acute infection. An acute infection, the symptoms often come and go. Like a cold. We get a cold, in a few weeks it goes away. A chronic infection is one that is constantly there. It never goes away. Like hepatitis, never goes away. Fever blisters, herpes, never goes away. It's chronic. It's always there. A latent infection. So I did say cold sore. So a latent infection would be a cold sore. It means that it comes and goes. But with like HIV and hepatitis, those are ones that are chronic infections. They never go away. But a latent infection would be a cold sore. It lies dormant away from the surface in a nerve cell until certain conditions, such as an illness with fever, sunburn, or stress, causes the virus to leave the nerve cells and seek the surface. And later on, we will talk about how cold sores are very contagious, highly contagious. Opportunist infection, also known as autogenous. It goes from bad to worse. So if someone has a cold, it can turn into pneumonia. Turn the page. All right, direct transmission. Direct transmission, pathogens can be transferred through direct transmission by coming into direct contact with an infection lesion or infected body fluid, including blood, saliva, semen, and vaginal secretions. So direct transmission, if I had AIDS and I went and had sex with someone, that is direct transmission. If I had a fever blister and it was oozy and gross and I walked up and kissed someone right on the lips, that is direct transmission. Now, indirect transmission is if we handle dirty instruments and then went and touched clean instruments. That's indirect transmission. Okay? If I had that cold sore and I coughed and then I touched my book and you came up and then touched my book and then touched your face, that's how you could get it. Indirect transmission. Also known as cross-contamination. So that's one important thing that we have to be very careful of in the dental office. So if we were assisting on a patient and the doctor needed extra gauze, we don't want to take our dirty gloves, get into the container, get extra gauze, and then hand it to them. We want to take our glove off, use clean hands, get out some gauze, and then put new gloves back on. So really watch your cross-contamination in the dental office. Okay. Airborne transmission. That's how they're saying that this COVID is getting passed around from coughing, sneezing, droplet infection is what it's known as. So airborne transmission, also known as droplet infection, is the spread of disease through droplet or moisture containing bacteria or viruses. Aerosols containing saliva, blood, that's created with the use of the high-speed handpiece, air water syringe during procedures. That's why it's important that we wear our PPE. We have our mask, our gloves, our personal eyewear. Because when we're suctioning, we're leaning like this and we're suctioning. And if you have long hair, where's that splash and splatter going from that patient's mouth? All over you. So I recommend to you that if you ever have kids or you go see your nieces or nephews, change your scrubs before you hold those babies, because you don't see it, but you have all that bacteria and all those germs on you from working all day with the splash and the splatter from the patient's mouth. That's why we use a high-speed handpiece, not handpiece, sorry. The suction, it helps cut down on that. Bloodborne transmission. Certain pathogens referred to as bloodborne are carried in the blood and bodily fluids of infected individuals and can be transmitted to others. Bloodborne transmission occurs through direct or indirect contact with blood and other bodily fluids. So, improperly sterilizing instruments or equipment can transfer bloodborne diseases. Common bloodborne microorganisms of concern in the dental office, of course, is going to be hepatitis and HIV. That's why, of course, we have to be very careful. Very careful. Making sure you wear your PPE, you should be safe. You should be fine. Now I want to talk about transit bacterium. Patients that have like a heart murmur, a pacemaker, an artificial knee, they have to take what's called pre-med. Pre-med is 4 antibiotics an hour. They have to take 4 antibiotics an hour before their appointment, because if they don't, the bacteria that gets stirred up in the mouth goes into the bloodstream, and it can settle around the heart and cause damage to the heart, not damage, but an infection to the heart. And that's known as transit bacterium. So making sure that anybody that has an artificial knee, hip, pacemaker, that they have to be pre-medded an hour before their appointment. Most of your patients know if they have to be pre-medicated. The doctor, their physician will tell them. If they forget to take their pre-med, most dental offices will have antibiotics there in the office. They can give them 4 antibiotics and tell them to come back in an hour. Unless the schedule is like completely full, then we have to reschedule the patient, because we cannot work on them without them taking their pre-med. Now we're going to talk about hepatitis. There's 5 different types of hepatitis. Hepatitis A is mostly through poop, caca. So, make sure that when you go to the bathroom, wash your hands. Anytime you have to change a baby's diaper, wash your hands. Okay. Hepatitis B, that's what y'all have already been vaccinated for. For hepatitis B, you get vaccinated when you're little. You get 3 rounds of shots. You get your first shot. Then exactly a month later, you go back and get your second shot. If you wait a month and 2 weeks, you have to take the first shot again. And then the third shot is 6 months after your second shot. If you wait 7 months, you have to go all the way back to the first shot again. So it's 1 shot, your first shot, and then your second shot is a month later, and then your third shot is 6 months later. Now, if an employee had never been vaccinated for hepatitis B, the employer has 10 days to offer that vaccine to the employee. Sorry. 10 days. So hepatitis C, once someone has hepatitis C, they will always have it. It will be that chronic. So they can treat it with medication, but they'll always have it. And hepatitis infects the liver. So the white of the eyes would look yellow. Their skin would look yellow, kind of jaundice. So that's a way to tell if someone has hepatitis C. But they also could be an alcoholic and have liver disease. But if someone does mark on their health history that they have hepatitis C, I would just ask them if it's active. Because some people will take, and it doesn't matter because we're still going to treat every patient the same. We're still going to wear our personal protective equipment, and we're still going to treat them the same. But in the notes, you can ask them when they contracted it, what year, and put that in their notes. Hepatitis D, that is covered under your vaccine for hepatitis B. And then hepatitis E, that's if you go to a foreign country and you're drinking the water from a stream where cows and bugs and gross stuff live. So, eating weird food, that's how you get hepatitis E if you from like a foreign country. All right, HIV. So HIV and AIDS. Someone can have HIV and live with it for years. Magic Johnson, he is a famous basketball player. He's probably had it for 20 years. And he takes medication. He, of course, has to make sure that he doesn't get a cold. He doesn't get pneumonia because that does weaken his immune system. And say he did get really, really sick and his immune system was compromised, then that's when it turns into full-blown AIDS. Herpes. So here we go with the herpes. There's herpes 1, herpes 2. Okay. I think of 1, and then I go downtown to 2. 1, 2, buckle my shoe. That's how I remember that 1 is the lips, 2 is your vagina or penis. I hate this chapter. Anyway, if someone comes into the dental office, and this is on state board, if someone comes into the dental office and they have an active fever blister, the dentist can reschedule that patient until it heals up. So on state board, it will ask, what is the one virus that a dentist can not see a patient for? And it will give you like A, B, C, and D. So A might be HIV, B might be hepatitis, C is going to be herpes 1, and then D might be herpes 2. So make sure that you pick herpes 1, okay? Known as HSV1. Okay, it won't say herpes, it will say HSV1 or HSV2. Make sure you pick 1. Now, when someone fills out their health history, okay, and they put down, because, it's everything is on there. Skin disease, everything is on there, heart disease, but herpes is on there too. If they marked herpes, don't ask what kind. Just leave it alone. Unless you see an active one, don't worry about it. Okay. But if girls and guys, if you have a fever blister and it's active on your mouth, do not have oral sex, because then that person can get herpes too. Yeah. It's that highly contagious. Very highly contagious. All right. So, of course, we know that it's a viral infection. And also, herpes chickenpox is known as herpes as well. So, human HZV, and some of y'all might have already been vaccinated for chickenpox when you were younger. And then herpes zoster is like shingles. So that's also, chickenpox and shingles are herpes as well. But it's type 3. All right. Measles. Measles, which can be prevented by vaccine, and most everyone has been vaccinated for measles. So it is easily transmitted, and it is a airborne transmission as well. So is TB. We talked about TB. If there's symptoms with someone with TB, they'll have a really bad cough, with like sputter and phlegm and yuckiness, unexplained weight loss, fever, fatigue, night sweats. And then of course their cough lasting longer than 3 weeks. Just know that is airborne, the TB. A patient who is diagnosed with the signs and description that we just talked about is in the active stage. This patient may easily spread the disease through prolonged close contact. TB is primarily spread when the individual coughs, and the TB, which is present in the sputum, are expelled through the mouth. So make sure that you cover your mouth when you cough. Legionnaire's disease. It is a excuse me, my allergies are killing me. The Legionnaire's disease is responsible for 2 accurate bacterial diseases. Bacteria are transmitted through aerosol and aspiration of contaminated water. No person-to-person transmission occurs. Bacteria have been found to thrive in lakes, creeks, hot tubs, air conditioning systems, shower heads. And so it's the biofilm that develops in like the water lines. And so Legionnaire's disease, how it got its name was years and years and years ago, there were a bunch of veterans that went to Philadelphia for a convention. And they stayed at this hotel. And weeks later, days later, several of them started dying. Just boom, boom, dying. And they couldn't figure out what was going on. Well, come to find out that there was bacteria in the water lines. And so the air conditioning unit had broke. And so for a few days in the heat, bacteria accumulated. So when they got the air conditioner running back again, it was spraying all of that bacteria into the air. And so that's how it got its name, was Legionnaire's disease. So in the dental offices, every operatory is going to have a water, it's a jug, and it's a water reservoir. And we hook it up to the dental water lines, and it helps cut down on biofilm in the water lines. And biofilm is like that nasty, slimy stuff on rocks in a lake. That it looks like that. It's called biofilm. So every office will have water reservoirs to help cut down on that. Tetanus, which is also known as a lockjaw, is an extremely dangerous and often fatal disease that's caused by spore-forming bacillus found in soil, dust, and animal and human feces. Yeah. When I think of it, I just think, oh my gosh, why are sandboxes even around these days? But anyway, so I do recommend getting a tetanus shot. Like if you stepped on a rusty nail, you would go and get a tetanus shot. So like I said, sometimes it happens, you get poked by things in the dental office. I mean, it happens. Not all the time, just be super careful. But if I poked myself, yes. But I had a tetanus shot. And like I said, it is good every 10 years. Oh, and I want to go back to the hepatitis B vaccination. Once you get vaccinated for hepatitis B, that's it. You don't ever have to get vaccinated again. If you want to see that if the antibodies are still in your system, you can do a blood test and it will tell you. But once you get vaccinated for hepatitis B, that's it. You're vaccinated. So now we're going to go to syphilis. Syphilis is a STD, sexually transmitted disease. There's a lovely picture of the guy down there on the bottom of page 63. The first stage of syphilis involves the presence of a painless sore known as a canker, which is infectious on contact, kind of like a fever blister. When it occurs on the lip, it may resemble herpes, but crusting is darker. The second stage of syphilis is also known as infectious or immediate infection. May occur through contact with an open sore. The third stage is known as the latent syphilis, is usually fatal. Someone could have syphilis and it lay dormant for 20 years. It's crazy. Also, another telltale sign is to see if someone has syphilis is I want you to Google syphilis, okay? And you'll see on people's hand, they'll have splotchy red and white circles on their hands. It can even be on their arms, on their feet, but it would be on the palms of their hand. And that's another way to tell if someone has syphilis. Okay, so that was chapter 5. Now, chapter 6, guys, y'all are going to watch that OSHA video. I gave you 2 different links for the OSHA video. So watch that. So everything in chapter 6 is covered on that on both of those OSHA videos. Okay, and then you're going to. I sent everybody through email the OSHA test. So write your answers down on a piece of paper and scan them into me. And make sure you put test A and test B. Okay, so I know what answers are for what test. And it will be all considered one grade. Okay, it won't be 2 separate grades. It will be 1 grade. But take both tests. And so OSHA. Who's OSHA for? OSHA is for us, the employee. OSHA wants to make sure that we are protected in the workplace. Okay? We have our PPE. The dentist is providing gloves, mask, protective eyewear. Say you have a staff member that gets belligerent and gets angry and hostile. It talks in the video how to handle that. Also, it tells you about your bloodborne diseases, how you contract them. Standard precautions. Standard precautions apply not only to contact with blood, but also contact with all bodily fluid, saliva, sweat, mucus, all that is known as bodily fluids. So we take standard precaution. Standard precaution basically means we're going to treat everyone like they have AIDS, an infectious disease. Okay. All right. It's also going to talk if you ever get poked. Say you accidentally get stuck by a dirty needle. What you're going to do is start milking it. Squeeze it. Start squeezing it. Don't even take your glove off yet. The minute it happens, start squeezing it. Take your glove off. Wash your hands. And then you're going to go to the incident report book that your office will have. And you're going to write your name, the patient's name, what you got cut or poked by, and how you took care of it. Like, washed my hands, applied alcohol, and a Band-Aid. So, because, say, 5-10 years down the road, you come down with something like AIDS, or HIV, sorry, you can go back and figure out who that patient was or what you got poked with and who it was involved with. Also, it's going to, again, talk about your hepatitis B. It's going to talk about your sharps container. There's a picture on page 68 of a sharps container. It's the red bucket looking thing. So anything that's sharp, needles, burrs, blades to a scalpel, anything sharp will go into the sharps container. Once it goes in, that's it. You can't get it out. Okay? There's a company that will come to your office once a month and pick up the sharps container. You don't throw it in the trash. They come and pick it up and they dispose of it like it needs to be disposed of. Also, you'll have regulated waste and biohazard waste. Biohazard waste in your dental offices, it will be a red trash bag. Anything that's saturated with blood goes into the biohazard trash can, okay? The same company that picks up the sharps container will pick up that trash. Do not put it in the regular trash, okay? Don't put it for the trash men to pick up. Preventing needle sticks. Preventing needle sticks. So there's what's called a safety device. It can be plastic, it can be metal, it can be rubber. But it would be like a little device, and when you go to recap your needle, you won't get poked. If you do not have a recapping device, you're going to do what's called the one-handed scoop method. And I want y'all to practice with your pen. And I'm trying to get my pen out. Oh, Lord. I can't get it out. Imagine you have a pen in this hand, okay? And you have the pen cap in this hand. Lay the pen cap down on a flat surface and then scoop with your pen, scoop up the lid, and then seal it firmly. That is known as the one-handed scoop method. That's how you recap a needle. That is on state board. Hand washing, 20 seconds. Wash your hands for 20 seconds. It's going to talk about personal protective equipment. It's going to talk about different gloves. You have your utility gloves, over gloves. Over gloves are like food handler gloves, what people when they're making your sandwich at Subway. So if you were working on a patient and you needed to get in the drawer to get something, you would put on the over glove over your glove and be able to get in the drawer. Your utility gloves, you know those big rubber gloves you use to wash dishes with? Those are known as utility gloves. So on state board, it says when you're disinfecting or cleaning a room, what gloves do you wear? And it's utility gloves. In the real world, we just use regular latex gloves. But on state board, we use utility gloves when cleaning a room. And instruments. And then sterile surgical gloves. Have y'all ever dyed your hair and it has those two gloves and you peel it open and then it's got a right and a left? It looks like that. They're sealed up in a bag known as surgical gloves. It's going to talk about material safety data sheets. Anytime we order a chemical, it's going to come with a material safety data sheet, and it's going to tell you is it flammable, how to handle handling and storage of it. So on page 77, it lists everything that's on that safety data sheet, and it's a book, the MSDS sheet book, and it is typically up front in a dental office. So you need to know where that is kept when you start working at your office. Ours is kept up front. Actually, no, it's kept in my room now. Our book is kept in our room. It's going to talk about an eye wash station. So at the clinic upstairs, it is in the lab, and it's attached to the faucet, and it's got two little green rubber stops. You pull off the rubber stops, turn on the water, and it shoots up, and you put your eyes, and it flushes your eyes out. And that's what an eye wash station is. Anything that's biohazard needs to be labeled. And then say there's not a label for something that's biohazard, you can make a secondary label for it and put it on a spray bottle. Say it's a spray a disinfectant spray that we spray the office with. Say we make our own, we can create a label for it. That's known as a secondary label. It's going to talk about things that are exempt from the labeling process. Anything that's wood product, food, alcohol, beverages, cosmetics. And then drugs that are dispensed by a pharmacy. If the dentist orders a bottle of amoxicillin, penicillin, it's exempt from labeling. So, and then drugs dispensed by a pharmacy to healthcare providers or direct admission to a patient also are exempt from labeling requirements, as are over-the-counter drugs such as aspirin and first aid. Okay, so y'all watch those videos and take that test. And then I will talk to y'all tomorrow, guys. Bye.